Hello and welcome. I'm wanting to go over a type of orthopedic problem that's not too uncommon to walk into my office with the complaint of lower back combined with hip pain. And often the type of hip pain that I wanted to expand on here is a type of pain that's not actually coming from the hip joint, but more in the gluteal musculature. Particularly one of the players that we see not uncommonly is called the gluteus medius. It's the muscle just below the bigger muscle, the gluteus maximus, more familiar to many of us. And this hip muscle is responsible for moving the hip backward as we walk and weight bear. And some patients will come in with ongoing recurrent problems with pain that they point kind of over the back and maybe even the side of the gluteal area, and might be close to the area that many have been told. I think you have bursitis in your hip, namely trochanteric bursitis. But when you really examine the patient, it turns out it's a much wider area and it goes more posterior, much larger than the bursa would be. So mechanically, this is a structure that is the attachment, if you will, of the gluteus medius muscle that's attaching onto the femur, the upper part of the leg bone. Or the thigh bone, and where those contact, that connection between tendon and bone, and just a little bit shy of that, you'll find reproducible point tenders on a patient. Particularly, I'll put them on their side, lay them so their hip is up, and then you just kind of sequentially palpate over the musculature of the hip, and often right when you get close to that attachment, they're very, very sensitive. So what kinds of things may cause this? Well, sometimes just walking, hiking, folks that do a lot of overland hikes and trekking, runners, hurdlers. It can be folks that maybe not all that active, but they'll notice it when they get up and out of a chair and start walking. It might ease up, but it seems like it always seems to get worse the longer that they walk or run after certain distances. They don't generally associate this with sciatica. Although the pain, interestingly, and I'll show a picture of a referral pattern based on how muscles refer discomfort to places that wouldn't seem very obvious. But this may refer pain all the way down the lateral right thigh, and it might be mistaken as part of iliotibial band, but usually a comprehensive, dedicated manual exam will help to differentiate those two. So what do you do about it? Well, if a person has this type of pain pattern, I often get patients referred from local physical therapists and sometimes other practitioners for consideration of injection technique or acupuncture or myofascial release therapies. So again, physical therapy usually a go-to because the technical term of gluteus medius tendinopathy, in order to address it, you have to make sure that it's not being contributed to by some other problem, like maybe there's lower back neural compression that's causing the muscles in the glute not to fire properly, so it's loading this muscle group unfairly. Or maybe it's coming from somebody's knee or ankle problem where they're favoring one side, so they end up loading the opposite hip. These are not uncommon problems to run into, but sometimes finding out what's making it recur is usually the puzzle piece that's missing, and then how to treat it. As I mentioned, physical therapy, soft tissue therapies. It might include myofascial release, standard kinds of massage therapy often will help. I've used electroacupuncture pretty successfully with cases like this to drum the discomfort down. If I've got some cases where they're not getting better despite all of the above, or if it keeps coming back, imaging may be necessary. Now, the problem with x-rays may show detail with the hip joint, which is appropriate, and sometimes we need to know that as well to make sure it's not stemming from the hip capsule. But if it's coming from soft tissue, we may end up needing either ultrasound, diagnostic ultrasound imaging, or MRI imaging. And recently have been working with a patient whose symptoms initially responded for months, but then came back again, and ultimately ended up getting imaged and finding that there was a partial tear of this tendon structure where the gluteus medius is attaching onto the bone, and that tear may be causing the recurrent problem, which has been kind of stymieing her physical therapy progress. So we'll be returning to more dedicated electroacupuncture, and if that doesn't help, we may be talking about prolotherapy, particularly with PRP, in order to help address the tear if there is a demonstrable tear on the MRI, or other imaging that may need something stronger than just hands-on work in order to get that tissue to heal, remodel, and repair. And hopefully that will, along with physical therapy strengthening, get them back on their exercise regimen, get them back on the trails, and hopefully get them back moving without pain. So hopefully this information might be helpful for somebody that you know, or yourself, or someone that you've talked to about a running injury or a hip pain injury that doesn't seem to be coming from the joint. Maybe it's coming from this area identified as the gluteus medius. Hopefully this information is helpful. And with that, I bid you a good day, and hopefully we'll be in touch soon. Take care. Bye-bye.